has the heart murmur, right? And that was she's breathing abnormally. So
but she don't have it. Okay, thank God.
Okay, so what they do see is that she has moderate diffuse bronchointerstitial pulmonary pattern, which is a fancy word for basically saying that her lungs don't look completely right. So they also say that she has congenital cerebral malformation, which means that her ribs right here are protruding inside to her stomach. Usually it's either from birth or if she had trauma there. But it's healed. It's just that her rib cage goes like this towards her heart instead of going like this. Because obviously on the x-rays you can see that. They're also saying that she has degenerative intervertebral disc disease, so which we know that she already has issues with her hips. And she has congenital, like it's, you know how she has trouble walking? They're basically seeing that in her spine.
You mean the disc?
Mm-hmm.
Press on the nerve?
No. They're saying that she has abnormalities in how it forms, so that's why she's walking.
But before she's okay.
Sorry?
Before she's okay, she's not born with that.
So it can be congenital. So it can be she's born with it, but it basically gets worse and worse over time.
Oh.
But it's stable. She's had this for forever. They're just seeing that on the X-rays.
The bone.
Yes. In the spine.
In the spine.
Yeah. That's why she sometimes, you know how she struggles sometimes to walk on her hind leg. She's walking.
Can I have a copy of that?
Sure.
X-ray.
Yes. I don't know if I can send the exact. Nicole would know more about how to send it, but I can look into how to get it to you via email. Does that work?
Yeah.
Yeah.
Normally, like the doctor, they open the PC. Then I can. Yeah. That's what I normally take photos of this. That's the fastest way to.
Okay. But because so basically, focusing on the lungs, because obviously that's the most acute thing right now. Those are stable conditions. The other two. This is having trouble breathing. So why does she have this weird pattern in her lungs, right? So it could be. They're saying that the pathology, why it's happening, is non-specific. So they're not sure. So the options are she either has asthma, which is unusual for this pattern. It's not common for asthma to show like that.
She never have.
Asthma can occur later in life, but yes, it's unusual. But it's still the primary consideration. Other differentials include pneumonia, which means she has an infection in her lungs.
Oh.
Another one is pulmonary edema, which would be when the heart isn't pumping in the right direction. Hemorrhage, which is blood, and less likely, cancer. Her heart murmur, because she has that heart murmur, they're recommending a trial with diuretics to see an improvement.
Mm-mm.
So basically, then when we look at her blood work, when we look at her blood work here, she has mildly elevated glucose, which is normal. She's not diabetic. This happens when they're stressed.
Mm-hmm.
Her creatinine and BUN, which are kidney values, are normal. Mm-hmm. They're even quite low because. Do you want to take a picture?
Mm-hmm.
Okay.
Yeah, that's good.
Okay. And then do you want to take a picture of this?
Mm-hmm. Okay.
Okay. So they're even lower than normal because she has some muscle wasting, and so sometimes they are not, but they are still within normal limits, so that's good.
Okay.
Her potassium is very it's one notch below. That could be from having diarrhea. That could be from a vast majority of reasons, but her other electrolytes are normal.
But she don't have diarrhea. She's constipated.
She's not constipated because she is defecating. Constipated would mean that she's backed up. She's having quite loose stool.
Oh, so it's not normal. Okay.
Yeah. Mm-mm. So then her ALT, ALP, and GGT,
everything okay.
Liver values are normal. Her amylase, lipase, pancreas is normal. Her red blood cells is normal, so she's not anemic. Her white blood cells are elevated, and her neutrophils. So what that's indicating to me is that either she has an infection somewhere. It could be the lungs, So she could have the pneumonia in her lungs, and then that's why those white blood cells fight infection. So it could be up because of that, or she could have an infection somewhere in her body that I'm not seeing, like inside her body. So, and then the x-rays, here's one of them.
Okay, show me that. So which part you said she have problem?
So this is her thorax, right? And this is her abdomen. So
this is the head.
This is the head.
This is the tail.
Yeah. So this is the heart. So this pattern is called a pulmonary interstitial pattern. So there's something wrong in the lungs. Either it's the asthma or pneumonia or hemorrhage or less likely neoplasia or pulmonary edema. Basically something inside the lungs, the actual lungs, is causing this pattern, and that is abnormal. There's not fluid in her chest. There's not fluid. It's just inside the alveoli, which are the little portions of inside the lung. Does that make sense?
Yeah.
So basically what I want to do is, if you're okay with it, I want to give her a convenient injection. So that's an antibiotic injection, to see if it helps with her lungs. If she does have pneumonia, I give her the antibiotic, and hopefully it will start resolving whatever is in there. It's not a cure-all, but it's something that basically we can start treating if it is lungs. Now we don't know what the pathology there's so many options of what it could be.
Oh, so this is just could be, but not.
So what we see is this pattern, but the pattern could be this, or this. So I'm going to want to treat for this, which is the pneumonia. And then I want to try, because pulmonary edema is one of the options, and I want to make her feel better, because I also want to make her breathe normal. So I'm going to try one dose, because the radiologist recommends a trial of diuretics, and diuretic is basically pulls water away, and she pees it out. So that if she has some fluid in her lungs, that we can try to push it out. So I'm going to give these 2 medications, and then I'm going to send you home, and if we see an improvement, great. But if we don't see an improvement, then we need to consider this other option of asthma. Do you know how asthma is treated?
I don't know.
Asthma is treated with an inhaler.
For the cat.
For the cats as well. So basically, do you think you're able to give an inhaler at some point? Okay. So basically, you teach the animal to put their nose in the inhaler and breathe, and basically give a puff. 1 puff a day. 1 puff in the morning, 1 puff at night. So I guess 2 puffs a day. But let's try, because asthma is still we're not sure if it is asthma.
Right.
So let's treat for the other things. See if that helps her breathing. If it does, we don't need to go down the asthma route. But if it doesn't, then we'll consider asthma. Okay?
So how long it takes to come back to see doctor? How long? In a week or?
If it's not improving?
No, I don't know. I don't know what procedures. If it's improving, that's it, right?
Yeah. Yeah. But if it's not, tomorrow, she should be breathing better by tomorrow.
Okay.
So if she's not, then we have to consider these other options.
Then, when should I bring her back?
Yeah, so I will call you tomorrow
to
see how she's doing. If she is not, if at all during any of this time, even tomorrow, the next day, anytime, if you feel like she's not doing well respiratory wise, so if she's increased breathing really heavily, and she's going into respiratory distress, so she's collapsing, she has blue gums, she's open mouth breathing, so basically it looks like a dog, but it's a cat panting, then she needs to be seen by a vet immediately.
But does she have blue gums?
No, that's what I'm saying.
Okay.
If those happen, take her to the ER, or if we're open, take her, because she needs oxygen. She needs supplemental oxygen. But if she is stable, so if she's at home, she's still eating, she's not open mouth breathing, she's not panting, she's doing her normal things, but she's just she's breathing a little heavier, that's fine. But if she goes into respiratory distress, she needs to be seen. Does that make sense?
Yeah, okay. I understand what you mean.
Okay.
So let's see what happened to her. If she's better and better, that's it.
Yeah. But if you at any point she goes the wrong way, she needs to go back to the doctor because she needs oxygen.
Oh, so basically you mean that other thing is just a finding, but basically for her breathing issue is the lung issue. It's not the heart issue.
We can't rule out that it is a heart issue. She might have a combination, but they're saying it is a pulmonary pattern that likely is either pneumonia, which is lungs,
or pulmonary, okay,
or pulmonary edema, which can be caused by the heart or it can be caused by the lungs itself.
Oh, okay.
Hemorrhage, which is blood, or neoplasia. So they're saying that it's most likely lung related.
But there's no blood.
They don't know because there's no blood in the thoracic cavity, so there's no blood around the heart, but there could be blood inside the lungs.
Oh.
Because of that pattern. You know how we talked about this pattern of, do you see how this should all be black? Lungs are filled with air.
Ooh.
So there's white stuff all over. So that is all of those differentials.
Okay.
We don't know.
What is that?
What is it? And that's why they're saying try all these different things.
Okay.
And if it improves, great. If it doesn't, then we have to do something more.
So there's nothing about constipation, nothing about that. Okay.
No, she's not constipated.
But you said where is the degeneration of the spine? Which part show the degeneration of the spine? You said
Yes.
degeneration of the spine.
No, I said degenerative intravertebral disc disease.
Oh,
It's a congenital disorder.
But which part show? Where is it?
It says there is moderate dorsal deviation of the caudal sternum.
Oh, you mean in the front?
Several intervertebral spaces are narrow. So basically, these are the intervertebrals, right? And these are the bones. And then there's a space in between the bones.
Oh.
So they're saying that it is closer together.
So this is the spine.
Yes.
So this is at the end of the bone. At the end of the
This
bone.
is the back.
The back.
Yeah, this is the
L4, 5, L4, L5.
This is the cervical. This is the thoracic. This is lumbar.
And then
yeah.
Oh, okay.
It's just upside down.
Oh, okay.
Yeah. Okay. And then this is where they're saying congenital cerebral malformation versus prior surgical trauma. When I was talking about the going in.
Sternum.
Do you see this? So this is the sternum. It should be flat like this. But it's concaving in.
Oh.
So either it's by birth or if there was a trauma there.
But they took X-ray before. Can you find it out? They took X-ray one time.
Here?
Yeah, because there has a skin tumor. They remove it. They asked me. At the same time, they took X-ray, but they didn't say anything about what you mentioned, any degeneration or sternal issue. I think 2023, possibly. The first time her issue is 2022 July. In Soho, Dr. Lee.
Okay.
Maybe you don't have that.
Yeah, I don't have the.
They have it.
Or it's because we switched systems.
Oh.
This system doesn't.
So can you send the X-ray to Dr. Lee?
Yes, she can.
Yeah, because she can do comparison. Because last time everything was okay.
It might be because basically these are just findings they found. These are not why.
I know.
Yeah.
Because I'm concerned about her walking. Pow Pow see doctor for her walking issue for 3 years already. Dr. Lee and the doctor here, everyone taking care of her case because of her walking gait. She cannot walk properly, and then she got infection of the body or all those stuff. That's why I said,
this would not be. This would not be causing that.
Yeah,
the congenital one, because that's from birth, and this.
No, I mean, I want to see the comparison because I don't have the copy. I never have a copy. I don't know. I never have a copy. So, okay. Can you send this to Dr. Lee? Because I think they have the copy.
So they have the same system as we do. We see it's the same system, and it's not in there. So it's the old system. We changed software.
Yeah. Can you ask Dr. Lee to do the comparison?
I don't think she has the actual X-rays, but I'll look into that. But it is we're closed now, so I need to go give the injections that we talked about, and then we can go from there.
Thank you. Okay. So basically, Pow Pow got trouble. Oh my goodness. But Pow Pow don't have problem on, water. It's a little bit complicated. Hopefully that can help.